Why do I have to go to the doctor 3 weeks after delivery? Guys, welcome back to the Mama Nurse channel. I'm Vanessa, and today we are headed to our 6-week post-op visit. So if you want to see what went on and why they started making you do a 3-week visit as well, stick around. Hi guys, welcome back to the Mama Nurse channel. I'm Vanessa, and today we're going to be discussing the difference between the 3-week postpartum visit and the 6-week postpartum visit. So go ahead and drop it down below. Let me know what state you're from and if they do 3-week visits in your state. This is completely new to me, and I've had babies the last couple of years, and we've always done just 6-week visits. So let me know down below what state you're in and if your state does 3-week visits, if it's something new or if you guys have been doing it. As always, don't forget to like, comment, and subscribe. Don't forget to hit your notification bell so that you can be notified every time I drop a new video. Let's start with the 3-week visit. So at your 3-week visit, you're basically going to schedule your appointment. They scheduled mine from right in the hospital. 3 weeks after delivery, I went to see my OB. You check in, you fill out a depression screening, and then you go to the back and they take your weight, your blood pressure, and your heart rate to make sure that all of those numbers are okay. Not necessarily your weight, but your blood pressure and your heart rate are within normal. Back to the examination room, and you wait until the doctor comes in. When they come in, they're basically going to do a mental health screening. Even though you did the depression screen in the waiting room, you give that back to the receptionist and they look over it before they come into the room, just to make sure that everything's okay. So when they came in, I went ahead and asked them why they started doing 3-week visits. As a nurse, I know when something changes, there's a reason for it. So the reason why they changed it was because in the minority community, especially African Americans and Latinos, there was a gap between delivery of a baby and their next checkup from their doctors. So they were starting to see an increase in mental health issues among phase. Seeing an increase in postpartum depression among African American women and Latino women. So because of that, they decided to schedule the 3-week visit so that they could catch it early and help mom with some type of treatment to make sure that her and baby are okay. With the 3-week checkup, you don't have to do a physical exam or anything like that. They're mainly just checking your mental health. They're going to ask how you and baby are doing. They're going to see if you're breastfeeding or formula feeding, if the baby is sleeping on some type of schedule, if they're sleeping in their crib. Also going to touch base on birth control. Typically, your OB doctor is going to talk to you about birth control throughout your pregnancy, but they will follow up at that 3-week visit just to make sure that same page as far as what birth control you're going to be taking. Now we're going to go into the 6-week visit. So at your 6-week visit, it's going to be similar to your 3-week visit. You're going to go in, you're going to do your depression screening, just a little questionnaire. I think it was about 10 questions or so. You'll do that in the waiting room and give it back to the receptionist so that the doctor can take a look at it before they come into the examination room. To the back, they'll go ahead and check your weight, your blood pressure, and your heart rate. And then you'll go to the examination room. At this visit, wear something comfortable that's easy to get in and out of, only because you are going to have to do a physical exam. I chose to wear a dress because dress and put on the little sheet. You women, we do these exams all the time, so you know that you'll be covered, you know, but it just was easier for me. I don't really like having to take off jeans, a shirt, a bra, and all of that. So you'll go ahead and get undressed. Then when they come back in, they're going to do the same depression screening. They are going to ask you how you and baby are doing. Make sure that you're still breastfeeding or formula feeding, how the baby is tolerating it, how you feel, how you're tolerating having a new baby in the home. They'll ask you if you have gone back to work yet, what your plans are for going back to work, and they'll also discuss birth control treatments again. If you do decide to do a Mirena IUD, just keep in mind that you'll have to do that 2 weeks after your 6-week visit, because your uterus is still getting back to normal. And if you're breastfeeding, it's recommended that you get that placed at 8 weeks rather than at your 6-week visit. So just keep that in mind. You also cannot have intercourse in that 2-week period from your 6-week visit to your 8-week visit. If you want to start birth control, I believe you can start that as soon as you deliver, or with your next period you would start there. Don't think that just because you're not having your period during this postpartum phase that you can't get pregnant. You can still get pregnant, so just make sure that if you're not planning to have any more kids, that you are protecting yourself. Exam, they're basically going to check to see if you had a episiotomy or anything like that. They're going to check to see how that's healing. Just make sure that everything looks okay down there. They are going to check your uterus to make sure that it's shrinking down to its normal size. They will ask you if you have any concerns at that moment, or plans for the future and things like that. I've been going to that office for a while now, and I also worked with some of those staff members before in the hospital, so we had a good conversation. I don't plan on going back anytime soon, so we had a good little talk. Just, you know, girl talk and things like that. It was actually the nurse practitioner that I seen that day. So her and I have developed a friendship since I've been going to that office. So pretty much for your 6-week checkup, just keep in mind you'll have to do the physical exam. You'll discuss birth control options. You will do any further follow-up visits if you need birth control placement. And they will also discuss the depression screening. If you are a working mom, keep in mind that you can get your work clearance form. You cannot return to work until you get clearance from your doctor, typically at that 6-week mark. It doesn't mean that you have to go back in that 6-week time frame. It all depends on your insurance and your job. Some people, like myself, I'm waiting until 12 weeks to return to work. But if you do plan on going back to work, make sure you get your doctor clearance form, because your job will not allow you to return to work unless you have that form. It's just a sheet that's saying that you're cleared for your regular work. If you need any type of light duty or anything like that, make sure to discuss that with your physician so that you guys can make an arrangements, and you can coordinate with your work as well. All right, mamas, that's it for this video. Don't forget to like, comment, and subscribe. Hit that notification bell so that you get notified every time I drop a new video. And don't forget to drop it down below. Let me know what state you're from, and if you guys have the 3-week visits along with the 6-week visits. Tell me if it's something new or if it's something old and Florida is just behind once again. Until next time, stay safe, be well, and live life.